This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
Welcome again to this week's Journeys, and we will take a second trip to Fuda Cancer Hospital at Jinan University. Actually, we're bringing them here after that very interesting discussion with Ferdy Ramos last week. We got many requests for more discussion on this great option for cancer patients. And that is the new technologies at the Fuda Cancer Center. And of course, we have again the coordinator of the hospital here, Mr. Segundo the Third.
Yes, sir.
Segundo Cruz
The third.
the Third, who is coordinating the activities between the cancer hospital and Manila, the patients in Manila, and so on. And we're very delighted and honored to have Dr. Ning, an oncologist of the Fuda Cancer Center, with us to help explain the operations of the center. Let's hear first from Dr. Ning. You are an oncologist, and how many years have you been practicing your medicine?
I'm to be oncologist for almost 18 years.
8
Years.
years.
18
8
years.
years, okay.
18.
And you 18, 1-8,
Yes, yes.
Serpan, yan?
Yes.
18 years, and
I'm
you look so
42 years
young.
old now.
Yeah, very young. And where did you graduate your where did you get your medical degree? Your
From Zhengzhou University, Medical School of Zhengzhou University. It's in North Province of China.
Okay, and can you still count how many operations you have made, you've done in 18 years?
I'm medical oncologist. I'm just
No. How many operations? Do you do surgery?
No, do surgery. I'm medical oncologist. I'm just
Oncologist.
I thought oncologists also do surgery. They don't.
The
They
surgeon.
don't.
the
Okay.
surgeon. The surgeon.
So what you do, you, as an oncologist, you study, you assess a case, and then give diagnosis and so on?
Yes, yes.
Okay. And so, segundo, I always
Yes,
say
sir.
that you should be primero.
Yes, sir.
But,
Yeah.
So, Dr. Ning is in Manila. What is the function of Dr. Ning while in Manila?
Okay. Every month he visit. He come to Manila.
Every
to,
month?
Yes.
He
to
comes-
offer free cancer consultation.
Okay,
So,
every month, how many days? Dr. Ning, how many days do you come here?
Almost 20 days here.
20 days?
20 days, yeah.
And then you back in China for 10 days only?
And go back to follow up the Philippine patient in our hospital. Yeah.
Okay. So then you're 10 days only there.
Yeah.
Then you're back here for 20 days.
Yes.
So
yes,
you're more
almost.
Filipino now than Chinese.
Yes.
You
so.
travel a lot. Huh?
Yes.
Okay. And so how many patients do you have right now in this visit to Manila? How many patients are you seeing?
How many patients from this year? You mean?
Here. While you're here to this
How many
20
patients
days,
we consult?
how many will
Consultation.
see you?
Maybe you can have the exact number.
Yeah.
I can't.
About 8
More
to
or less.
10. Yeah. About 8
only
to 10.
8 to 10. So only less than one patient a day.
Yeah. Yes.
You
yes.
spend a lot of time per patient.
Yes.
Yes.
Okay. So now I understand an oncologist does not do the surgery.
Yes.
Somebody else does the surgery.
Yes.
And so if I'm a patient, I come to see you, you ask questions of me.
Yes, about the symptoms, about the stage of the cancer, and about what the treatment you have received.
And you explain, you go to the background, the history.
Yes.
And then when you have an idea of what to do, you explain also what procedure that will I will have. Is that right?
It take about 1 to 2 hours to have an interview with the patient or relative of patient to discuss the cancer tumor, what we would do to help the patient, and what's the prognosis of the treatment.
Okay, and where does the patient get his X-rays, blood tests, and so on? In your office or here in the clinics here, or they go to China for those tests first?
The usual steps. They get this CT scan, blood tests, and some other reports from their doctors, from the clinics here, the local Philippines. Okay. And then they come and visit us and bring all of those results. And then that's the time we start to review it. And then explain to them what is their disease, what is the prognosis, what will happen in the next months, something like that.
Okay. Earlier, I was asking, of course, last week our discussion was on the Nano Knife surgery with Ferdy Ramos, one of your patients who is very happy, and he looks very well now. So how many methods and this Nano Knife surgery, what cancers can it be applied to?
Nano Knife is a new technology. It was approved by the Chinese FDA last
Food and
year.
Drug Administration.
Approved only for the liver cancer and pancreatic cancer.
Okay.
Now we perform more than 150 cases of liver cancer, include pancreatic cancer in our hospital.
And by how much has this increased the survivability of patients of liver and of course pancreatic cancer? Everybody says it's almost a death sentence.
Yes.
How has this improved it? This new technology?
From published articles of American, compared with other treatment, the pancreatic cancer lifetime is about 1 year. But after Nano Knife, we can double the time. We can live for almost 2 years.
2 years.
Yes.
And if it's completely cured, or you can never tell. You just have to keep having checkup.
Yes, it's new technology. Yeah, we just follow up. Maybe we accumulate all the a lot of cases. We can get some conclusion about how the Nano Knife works.
So it doubles the life expectancy.
Yes,
but are there longer survivors?
We hope
you still have to see, because this is a new technology.
Yes.
Okay. And for the other cancers, let's say breast cancer, the most common cancer, breast cancer, colon cancer.
Lungs.
What else? Lung cancer.
Lung cancer,
3.
yes.
What are the recommended methods?
Lung cancer in our hospital, we always do the cryosurgery,
Cryosurgery,
the brachytherapy, and combine with the intervention chemotherapy, all these methods to help the patient.
So immunotherapy is not the same as chemotherapy?
No, immunotherapy.
Because I was telling you, I read a lot, and many people these days read a lot about the chemotherapy is sometimes more deadly than the cancer.
Yes.
What about immunotherapy? It is safer.
You're safer, yes.
What is the process of immunotherapy?
Immunotherapy is not the main treatment to the cancer. It's supplement of the other therapies.
It's a supplement only?
Supplement, yes.
Yeah, okay.
Maybe in the future, now the fourth generation of immunotherapy, the CRT, new technology. We call it the first generation of immunotherapy. Now it can cure the lymphoma, some melanoma, some malignant diseases. Maybe in the future maybe the immunotherapy be the main treatment to the cancer.
And so if immunotherapy is a main treatment, then there is no need for surgery, is that correct?
In the future, maybe I'll combine all the treatment together.
Put together, it's still the best to apply it as a group of therapies.
Yes, surgery, radiotherapy, and chemotherapy. Now also is the main,
but if you have Nano Knife and cryosurgery is also very minimal invasiveness, right?
Yes.
So these two, and then so the traditional surgery where you open up a big hole and so on, maybe will eventually not be needed because that is very damaging to the body, right?
Yes, yes.
Yeah, yeah. And so I think we have some videos and clips about Fuda University last week that we did not show. Are you ready, Joshua, to show some of them? Maybe you can explain what they are. Okay, let's take a look. Are you ready, Joshua? Is this you? Needles, no more slicing open.
At the beginning of the Nano Knife, it's opening the
Yeah.
abdomen. Now it's just a puncture outside the skin.
And
direction.
Ferdi Ramos's operation was only 10 minutes, you say.
Yes, 10 minutes. It's three little holes
Yeah,
on the skin.
it's so small. Last week we had to get a red ball pen
Yes.
to mark it to see it.
Yes.
Yes.
Yeah, and at 10 minutes, you say, but recovery in the recovery room is around 1.5 hours.
Yes, maybe in the next day and the day after tomorrow, he can go work and
Go
eat
work a normal
food.
life already in the
Yeah.
next day.
Yes.
And if it is the Whipple surgery, is that called?
Or whip surgery.
How many days in the hospital?
Hospital at least 1 month.
1 month.
Yes,
Okay,
1 month.
okay. So, how do people avail of the services of Fuda University from here, from the Philippines?
Yeah, they can visit us in our office at Centuria Medical Makati. We are open from Monday to Fridays.
Where's that building?
Centuria Medical Makati is along Kalayaan Avenue in Makati, besides Makati Avenue, inside Century City. Yeah.
Okay. I'm not very familiar with the new areas in Makati.
Yes,
and,
yes.
So earlier I was speculating that if I ever have cancer, I estimate maybe I will need to set aside for 1 whole year treatment around 2 to 3 million pesos. Is that correct? Or maybe less. You were saying maybe
it's about-
1.2 million?
Yeah, you need to prepare about 1.2 to 2 million for 1 year. Yeah.
Yeah. Well, last week we were discussing, what about poor people? How do they avail if they need to avail of such surgery?
Maybe some Philippine patient, the local patient, maybe we can give some or we can give the free consultation. Maybe we can get some
okay.
suggestions. Maybe
Okay.
the patient can undergo the treatment in Philippines, local
Yes.
hospitals.
But
public hospitals.
no nano
Yeah.
surgery here.
Maybe in the future we can introduce the technology to Philippines.
Yes. Well, we were discussing maybe to set up a foundation
Foundation,
Yes.
yes.
in the Philippines and get some donors
Yes,
because
yes.
some of these billionaires will just throw in maybe a
Yes.
few
Millions
million.
also. Yes.
Yes.
So that we can help more.
Yeah,
Yes.
yeah.
Yeah.
So maybe you can say something to our audience. We're almost at the end of our discussion.
You first.
You.
Thank you for me to have an interview with the Philippine people here. I'm come from Fuda Cancer Hospital from Guangzhou. I just want to have more cancer patients, not only China but also Philippines and other countries. Thank you.
Okay, thank you very much, Dr. Ning.
Thank
And
you, thank
we
you.
will see you more often, okay? Sige, hindi pa. We're still on cam. Okay, we'll take this break now. After the break, we'll be discussing with Mr. Ado Paglinawan on the recent arbitration results.